medical grade hearing aids. What are they? What do they do? Are they made in a factory by an eccentric man in a purple suit with an army of singing and dancing little people?
Welcome to the Ask an Audiologist podcast, real audiology white papers written by real audiologists and explained to you by a real audiologist and a guy who isn't. Now here are your hosts, Dr. Jordan Strong and Kevin Ziener.
On a day that we will never forget, we are happy that you remember to tune in to a brand new episode of Ask an Audiologist. I'm Kevin Ziener.
And I'm Dr. Jordan Strong.
Written by our good friend Deanne Rudden of Longmont Hearing and Tinnitus Center. Today, Dr. Jordan is going to be diving into the wonderful world of medical grade hearing aids. What are they? What do they do? Are they made in a factory by an eccentric man in a purple suit with an army of singing and dancing little people? Stay tuned to find out. And even though I just took this in a joking manner, prior to us recording this, Dr. Jordan said, this is a very serious and up-to-date topic that we're discussing. And I said, Great, watch me make a joke. So
I love it. You gotta have the humor in it.
I'm trying to counterbalance the seriousness of the potential topic with Willy Wonka. So Dr. Jordan, talk to us about this somewhat new sensation in the world of audiology, medical grade hearing aids.
Yeah, so it is. It's fairly new. The term medical grade hearing aid really didn't exist prior to, I believe it was October 2017.
Wow.
When over-the-counter hearing aids started to evolve and there was a bill passed to get over-the-counter hearing aids put out into the world.
Sure. And that was primarily to make, I'm going to use this lightly, hearing healthcare affordable to just the normal Joe on the street.
Sure, yeah, okay. Just easier accessibility. Yeah. But from that, they kind of changed up the terminology. So it started, now we have over-the-counter, and now we have medical grade hearing aids or prescription hearing aids. Okay. So from that, we've got different styles of hearing aids in both categories. Yeah. They can look really similar, but it's just like any other technology that we have. It comes down to the chip on the inside.
For sure. So I think, a few weeks back, we discussed, weeks back, kind of what OTCs are. Like refresh our mind on what an over-the-counter hearing aid is and theoretically can do. Mm-hmm.
So an over-the-counter hearing aid is only going to treat a mild to a moderate hearing loss. Okay. And the FDA did create quite a few rules around what they can and can't do. Okay. It's going to be different as far as what it's able to produce and as far as sound quality and noise reduction, aesthetics, rechargeability. I mean, there's some big differences. Sure. But yeah, I mean, over-the-counter hearing aids they're constantly evolving. There are tons of them coming out daily from even big names. Yeah.
I think it's also important to remember that over-the-counter hearing aids can be bought like at a CVS or it can be bought at a Best Buy. Mm-hmm. And so when I say that, I'm clearly drawing the line to there is no medical professional disseminating that. Yeah. OTCs are typically in need after a self-diagnosis or just a general belief. And as we've discussed on this podcast, it's one thing to think you have hearing loss. It's something completely different to have been diagnosed with hearing loss, especially if it's just a fullness in the ear that could be earwax or that could be an ear infection or a melody of any other issues. So you're kind of just relying on yourself and Dr. Google to give you the diagnosis to then go by what you think is the right treatment. Right. Is that fair?
Absolutely. Okay. Good job, Dr. Kev.
Thank you very much. Appreciate that.
Yeah. So, that can have a lot of implications to it. If you have wax in your ear, it could just be wax and you don't need that at all.
And then that unit's never going to work.
Right.
And so now you're just going to think maybe it's the technology. I should go get a different piece of technology.
Right.
Now you're throwing real good money after bad, but it's really bad money after bad because you didn't get the diagnosis in the first place.
Exactly.
So then tell us about medical grade. Yeah. Because I know of hearing aids, I don't know of medical grade hearing aids.
So It's the same thing. It's just, like I said, recently that terminology has changed, and medical grade hearing aids are what we traditionally think of hearing aids.
Got it.
So with a hearing aid, that's going to be very fine-tuned for you. It's kind of like when you go to get a glasses prescription, it's fine-tuned for you.
For sure.
Same way with a hearing aid, traditional hearing aids. Whether it doesn't really matter the size or shape or what it looks like, but we're going to fine-tune and program that hearing aid specifically for that individual.
Got it. And I think, again, that's like the main difference is
right.
When you come into a practice like Dr. Jordan's, you're going to go through the battery of tests and examinations, and it's going to be thorough. And regardless of what the diagnosis is after the fact, you can now comfortably and firmly understand that you are being given the thing that you need, or not given
correct
the thing that you need.
Yeah.
And so it just, for the cost of the hearing exam of the visit, that's all you're paying, as opposed to hundreds of dollars for a piece of technology that you're kind of fingers crossed hopes that it works, right?
Right, yeah.
And so I know that there's a myriad of other different types of hearing aids, but like kind of walk us through like the traditional styles.
Yeah. So I guess the first one is called a behind the ear hearing aid. That's typically going to treat more severe hearing losses.
Got it.
And that has a piece that goes behind your ear with a tube that comes down, traditionally with an ear mold that's on the end of that goes down into your ear.
Got it.
From that, they started kind of redefining that, and they came up with what's called a receiver in the canal, or receiver in the ear, or what we as audiologists call a RIC.
RIC.
Yep.
Okay. RIC.
That's right.
Okay.
RIC. So with a RIC, it's just a little bit smaller version of a behind the ear or a BTE hearing aid.
Okay.
So it's smaller, still sits on top of the ear, but instead it has a little wire that comes down in front instead of like an empty tube.
Okay.
So it's going to have a wire that comes down in front with a earpiece, whether that be like a piece of rubber, it's called a dome, or that be something that's custom.
Got it.
Either way, that'll fit on a RIC. And then they just get smaller and smaller from there.
Got it.
We have one that's in the ear, where it just sits down into the ear canal, and then there's a part that's on the outer part of the ear. Those kind of look more like some of the earbuds that are out there.
Sure.
So it'll kind of fill up what we call the concha bowl.
Okay.
Where it'll be a full shell, can be a half shell, but it's typically going to kind of fill up the outer part of the ear. You're going to see it.
Yep.
From there, you've got an in the canal. You've got a completely in the canal, invisible in the canal.
Ooh, what's invisible in the canal?
Yeah, I mean, it's exactly what it says. It's so tiny. It gets way down in that ear canal. You really can't see it. I mean, of course, depending on the size of the ear. If you have a really big ear canal, you look at it from the outside, you're going to kind of see it. But
fair enough.
For the most part, you're not going to see those devices. They're very small, but they also have limitations. The smaller that they are, the less we're going to be able to fit in them technology-wise. You know, Bluetooth, wireless connectivity for when we're programming them. You know, it's not going to fit all of those things in it. And depending on the size of your ear canal, what we can fit, what the manufacturer can fit.
I was going to say, what's like the most common fit for your practice, for audiologists in general? I mean, I know it depends on the type of hearing loss. It depends on the individual, their lifestyle. But like typically, what are people migrated towards? Definitely
a RIC.
Okay.
A RIC is going to encompass the most as far as different types of hearing loss. We can really modify it more than any of the others. So whether that be like an open fit, where we're leaving your ear canal as open as possible with like a dome, or closing off that ear canal with a custom earpiece where you have a more severe hearing loss and we really need to drive that volume in there and close off that ear canal. That RIC is really what's going to kind of encompass the most. And I mean, at least in our practice, I would say we fit probably upwards of 90%.
Wow.
It's the vast majority of people with a RIC.
So put a bow on this topic for us. As it relates to medical grade hearing aids, what are we seeing as the main difference, or the main need, or their general purpose as we know it today?
Customization, individual, prescription for what you need. It's your prescription. We didn't even think about your hearing test being your prescription before all of this came up with OTCs. But now it's definitely something I mean, it's not that it's changed.
Sure.
We're still doing it the same ways that we've always done it.
But it's almost like OTCs have allowed audiologists to be a little more professional with the process now.
Yeah. It's definitely changed the world as far as hearing goes and how we go about treating things. In the grand scheme of things, no, we haven't changed all that much, but we do think about it differently.
Sure. Yeah.
Yeah.
And now that we've established that it's less magic and more assembly lines to bring medical grade hearing aids to the masses, please remember to visit us at askanaudiologist.com for all your hearing health care needs. Dr. Jordan, thank you so much.
Thank you, Kev.
We'll see you guys next week.
See you.
You can find more information at askanaudiologist.com, and you can follow us on all our social channels at Ask an Audiologist. The information provided on this podcast is for educational and entertainment purposes only, and does not substitute for professional medical advice.
The grossest story.
Yeah, the smelliest, grossest story.
There's no visual, but if your stomach turns, bear with me. I have 2 of them.
Dr. Michael can craft a tale, so he will catapult you there.
Yeah, here we go. I got my brushes ready. We're gonna Bob Ross this thing.
Yes.